Ray Franscioni was born and raised on this ranch in the Salinas Valley. His passion is wine, and he's been harvesting grapes here for a decade. But a life of work in the fields and an awkward dismount from his horse one day had taken its toll on Ray's hip.
I mean, it was the point where I had to be a contortionist just to put my socks on, just to be able to tie my shoes.
In addition to his own physical discomfort, his bad hip was limiting him at work.
I could not pick up, for instance, a case of wine and carry it to the pickup or any distance without feeling some severe pain in my hip.
But those that know Ray are aware of his tough skin and reluctance to ask for help. Dr. Alan Hershey at Salinas Valley Memorial Hospital's Joint Replacement Center had the tools to fix Ray's hip. But scheduling a surgery happens at each patient's pace.
Ray Franscioni had been seeing me for several years in the office for hip pains and was limping and having a lot of pain, but he was hesitant to have an operation for pain because he's a rancher and a hard worker. Really didn't feel like he wanted to take the time off work.
It finally took a family intervention to get Ray into the operating room.
Complaining of pain, you can't sleep, you're limping, and in Ray's case, I think it was his family who finally said, Dad, his daughter said, Dad, get in there and do this operation. I'm tired of hearing you complain about it.
Finally, when I made the decision to do it, I didn't want to wait any longer because I had things to do. The grape harvest season was right around the corner, and I really wanted to get it done so I could have the mobility back that I definitely missed.
The reason for Ray's pain was rough, inflamed joints rubbing together in his hip. He felt it with each step. Dr. Hershey's task was to make walking in his boots a comfortable chore again.
When we do a total hip replacement, we're removing the worn-out surface of the cup and replacing that typically with a metal socket.
With the smooth mechanical surfaces now doing the rubbing in the joint, the hip feels brand new.
Just to be able to do this was impossible. I couldn't do that. I couldn't lift my foot up and climb up on a wall, you know?
I think he was out of the hospital probably in 2 days, I think. It's not uncommon if I have a person who has surgery Monday that they're home by Wednesday afternoon.
Why I waited 10 years is ridiculous. I should have done it 5 years previous at least, you know, because it's not worth the pain and sacrifice time.
The number one benefit is pain control. That's the single really best answer for why you need an operation is pain control.
It just feels 100% normal. So you take those things for granted, believe me. People that don't have this kind of pain, that don't have a problem with their hips or joints, really don't or can't understand what it feels like to have that pain and then to go through an operation like this and then to be pain-free. It's like night and day. It's like a whole new beginning.
Ray's new hip will last 20 or 30 years, maybe even the rest of his life without any problems. That means getting back to his harvest and enjoying the fruits of his labor, whether that be Pinot or Chardonnay.
A lot of people have asked me, so you really feel like you're 25 again? I said, absolutely. You know, it's amazing. And anybody that has any kind of pain like that I suffered before, all I can say is get it done as soon as possible because you won't regret it. You know, feel great.